thing about Katrina and New Orleans is that the data told us, long before there was ever a hurricane that hit, that we could have anticipated the lower Ninth Ward lagging behind because of the socioeconomic data and the other risk data that goes into something called the Social Vulnerability Index. This is an index that's used by the Centers for Disease Control. It's something that's similar to what public health professionals do when they try to predict where are we at the greatest risk for a certain disease vector going into this community or that community. Looking at things like socioeconomic data, race and ethnicity, immigrant status, first language not being English, single parent households, carless households. All of these things, when aggregated and mapped over an entire city, tell us which communities are the most vulnerable. We knew that. We had that data before Hurricane Katrina. We could have predicted that the lower Ninth Ward was going to be at greater risk and therefore would lag afterwards. We could have invested in the lower Ninth Ward before disaster struck. And now here in LA, we're determined to make sure that doesn't happen here, that we can invest before, at least in some of our most vulnerable communities.